East African country of Uganda, there are only 12 physicians and 5 hospital beds for every 100,000 people. The government spends less than $9 per person per year on healthcare.
To compute, for example, the medicine requirement for everybody in a year, the budgetary provision still falls short. It is still not, good enough.
The situation is only made worse by corruption and mismanagement.
The PSC funds, people were not allocating it as it should be. Selling of other items like nets, child cards. These things are to be given free of charge, but since it was sold.
In far-flung areas of the country, like Apaj, a lack of oversight often deprives rural communities of services like attended births, immunizations, and antibiotics.
Sometimes when things are not there, we are forced to say, why can't you look around and then you get something and then you are given service.
PTF introduced a new technology to help communities take action. We developed the Citizen Action Platform, or CAP, for people to send anonymous reports of corruption whenever and wherever they feel safe. Reports are received by the Apaj Anti-Corruption Coalition, supported by the Anti-Corruption Coalition Uganda, through existing communications technologies of UNICEF and Transparency International. These breakthrough partnerships give local organizations access to powerful technology tools to gather information through citizen participation.
We developed jingles running on radio each quarter, telling the citizens on how they can join the U report, and they have been doing this all over this period.
Women are the most disadvantaged when it comes to service delivery. So they are very strict, and they don't miss out anything. If there is some gap, there is a problem in any of our health facilities, within 2 minutes, the message has reached TAC, has reached MTRAC, is already coming to us, and we respond rapidly if it is something that we can, take action on. If it's something big, then we forward the information to the right authorities.
Anyone would have to see that there's an outcome of the dialogue, that when they're sharing something there has an effect. Mm-hmm. Something's actually happening.
ICT is just a tool. ICT cannot work in isolation. So one of the core things was the citizens embraced this platform. Secondly, the other thing that I saw happening was the partnerships that were happening between APU, TI, PTF, UNICEF.
All those things. And the transformation was incredible.
The impact that we have made in Apaj, I believe it's the same thing that affects the other districts of Uganda as well. I feel like we're being unfair to these other districts by only focusing on and yet the other districts as well are really in need of this kind of service.